There is nothing called virginity in the medical world. In fact, there is no medical test or no clinical examinations where we can ascertain that a girl or a woman is a virgin or not.
I have to ask, why do you think? Is it a stigma?
Traditionally and culturally, virginity has been equated with purity of a girl.
Now our younger generation will completely disagree.
You cannot weigh the worth of a woman just with the integrity of a vagina, right?
Exactly. So what we are going to talk today is about hymenoplasty or hymen regeneration, or we can talk in a very layman term. You repair your virginity. This is what people generally come to the clinic and tell us. Now, first important thing is that we have to find out, is virginity and hymen repair the same thing, or are these two different nomenclature, and how do we understand?
So there is nothing called virginity in the medical world, okay? So this is something that has been coined or given any importance just socially or culturally. Medically, virginity is not a condition. In fact, there is no medical test or no clinical examinations where we can ascertain that a girl or a woman is a virgin or not.
I have to ask, why do you think? Is it a stigma? What is it that makes this
traditionally and culturally, virginity has been equated with purity of a girl, right?
Which I'm sure our younger generation will completely disagree.
Yes, definitely. You cannot weigh the worth of a woman just with the integrity of a vagina, right?
Exactly. So, is there some term as virginity restoration surgery, or is it just a fancy word given by somebody? Let's not pick up a name, but somebody who is given, or is it something really, such kind of surgeries do exist and you as gynecologists practice such?
Yes. Virginity restoration is basically hymenoplasty. That means repair of the
So why do
hymen.
they give that name? Virginity restoration.
See, like I said, because people equate.
Okay.
Traditionally people have equated that hymen intact means the girl is a virgin.
Right.
Okay, but it is not. So now we know that it is not. So traditionally it has been named like that. So when we are repairing the hymen, people are thinking that we are restoring the virginity. But actually it is just the repair of the hymen.
Okay. So the next question, which I'm sure our audience also would want to know, is this procedure safe?
Oh yes, absolutely. If you get it done in the hands of a trained gynecologist, a trained doctor, in a proper, clean medical setup, right? So then it is an absolutely safe daycare procedure.
Okay. So how long does this procedure take usually?
It's a very short procedure. Usually we finish it in say 15 to 30 minutes.
So it's a daycare procedure?
It's absolutely a daycare procedure. Okay. There are no stitches. Okay.
And is it like the patient can just go about with their daily activity immediately?
Absolutely. That's the whole idea of daycare procedure.
So for our audience, this is definitely a procedure which is very safe, like Dr. Smita is saying. Okay. Is it done under complete general anesthesia?
No, it is done under local anesthesia.
Okay, wonderful. Okay. So even another advantage is...
It is done under local anesthesia.
One more question is that because you are also into lasers, I practice in my dentistry as well as in aesthetics lasers. So is there a way of getting this hymen repaired or regenerated non-surgical way? You spoke about surgical part all this while.
Okay, so I'm really happy that you picked this question, Swati, because yes, there are some non-surgical techniques. So it's not laser, but it is fillers. So when somebody is going for a hymenoplasty, you need the results of the thickness or the plumpness to last for some time.
Yes.
So yes, some people do fillers, but it is not widely studied. Okay. And so you must always go to somebody who does this kind of work and who is well experienced in doing it symmetrically. Interestingly, there are many websites and there are many online stores selling hymenoplasty repairing kits.
Okay.
So those are, I know it's so shocking to even hear it, okay? So those are basically just glues or adhesives. And it sounds ridiculous and I can't imagine somebody doing it. But trust me, I have seen patients do this and come. It is horrifying, okay, if you
Yes.
see the results. But imagine if it really worked like that, and if it really closed, you will not get space to let go of your menstrual blood. So the menstrual blood is going to get collected, and it is going to result in another medical condition which will require you to be taken into the OT, and the hymen has to be nicked for the menstrual blood to flow. Okay, so it's a horrible thing. So to your audience and to our audience, I hope that nobody chooses this.
Yes.
Your doctors are well aware about your needs. Choose a good doctor, go and discuss this, okay, and then with adequate knowledge, choose the right treatment for you.
Okay, from here I have one more question.
Yes.
So even I have read somewhere that, when we use this menstrual cup or
Yes.
tampons, do they actually tear or break the hymen?
Tampons are a very bad menstrual hygiene choice. So you have something called the staphylococcal aureus syndrome, okay?
Yes.
It's called the SST. So tampons are the worst thing a woman can choose during her periods. Why? Because you put the tampon into the vagina, and the tampon is absorbing all the menstrual blood and
Right.
swelling.
Yes.
So it's like a breeding ground for bacteria.
Yes.
And among those bacteria, if Staph aureus comes and catches you, then it leads
Then
to
you have it.
huge infections, okay?
Yes.
Very bad, it can be life-threatening. So the tampon is not a good choice. Yes, many women are comfortable with menstrual cup. If you know how to, sterilize your menstrual cup and clean it daily and regularly empty it, sterilize it and use it, it's a good choice. When you're pushing it, yes, there is always a
there's
risk of
risk.
tearing the hymen.
Hymen. Okay. So what is that one thing you would advise if anybody is wanting to go for this procedure? What is that one test if they need to get it done? You can also mention if they have to get in, and what they can expect, or what is that message that you would want to tell them? That
No, first and foremost, understand your body. Understand why you want it, okay? Then try and discuss with your doctor and understand what you can expect out of the surgery. Pros and cons. What are the necessary complications? What are the complications that can happen? Then, once you have adequate knowledge, you decide whether you want to proceed with it or not. And the final take, your doctor will help you, because it's only when we examine a woman. So, depending on how much of hymenal tissue is remaining in her, we can give her or we can promise her that kind of outcome.
But ultimately, it really doesn't matter, because
Of course, because no woman's worth is judged by a
yes,
membrane, right? We just want to let all the women out there know that if it is something that you want for yourself, you have many right places to go to. You have many right persons to go to. Choose a good doctor, get proper consultation, discuss thoroughly with your doctor, and I expect you and your doctor to give yourself time to understand the procedure and then go about it. But if you choose to have the procedure, please follow the post-op advice thoroughly and regularly, because you don't want to end up with infections for an unnecessary procedure.
can I ask you what could be or what will be your one advice to the men who would want their wife to go for this or their partners to go for this?
So, to the men out there, the women in your life, they are much more than just a bed partner, right? So, don't put that weight on her about just a small part of her body. The woman who's with you, she's so much more than just that membrane. And appreciate her for the woman that she is. I'm sure she gives you so much more in life. She fulfills you in so many ways. She takes care of you and your family in so many ways. So let those be the bonding, the bonds that you share with her. Instead, of course, as a couple, if you feel that this is something that you both want as a couple, then yes, you totally should support her. But there should be no unrealistic expectations from the woman who loves you. And if a woman has chosen to have a hymenoplasty just because you said so, the man said so,
Yes.
Definitely you play a big importance in her life. So, make that importance worthwhile. Live up to it. You be a man worthy of that importance and worthy of her love.
Wonderful. It was lovely talking to you, Smita, today.
Thank
Not about clinic or patients, but about something which
We even have not discussed as sisters.
As
Yes.
sisters, we haven't spoken.
I must congratulate you for picking up very good questions.
Yes, thank you. But to our audience, I promise I'll bring her back with such more interesting topics so that she can give us an insight about how to go about and should we at all go for such kind of procedures. Of course, if our body wants it, we want it. We should definitely go for things that makes us happy, and I always believe that what gives you peace, what gives you happiness, that smile, go do that. So with that, we will sign off today and see you next time.
Bye.